Well, hi, everybody, and thanks for joining us. My name is Greg Olsen. I'm the director of the New York State Office for Aging. Today is Thursday, March 4th, and we couldn't be more pleased to bring this program to you today. March is actually National Nutrition Month. It's also a month for the March for Meals campaign. I'll talk a little bit about that. And before I introduce this amazing panel that we have, I want to talk a little bit about context and why we're here today, why March is so important, and why what we're going to talk about today is so important. So as I mentioned, I'm going to apologize for my puppy that you may hear in the background, who's eating his super bone that I can hear, and I'm sure you can too, so bear with me a second. So as I mentioned, March is National Nutrition Month. New York State has the largest nutrition program in the country. That was true pre-COVID. Certainly has expanded significantly over the past year with COVID. By way of a little bit of background, the Older Americans Act authorized the establishment of the congregate meal program. Those are meals provided in senior centers and other congregate settings in 1972. Since then, we've developed a network of 819 congregate sites across New York State. In 1977, the home delivered meal program was authorized under the Older Americans Act, and we currently have over 2,100 home delivered meal routes. We're providing over 24 million meals to almost 300,000 people, and those are all pre-COVID numbers. We're going to talk a little bit today about what's been happening over the last year and the significant expansion. What we do in New York is a little bit different than what happens across the country under the March for Meals campaign. What that really does is focuses in on simply the home delivered meal program. But the nutrition program that we oversee and operate with our partners, some of which are here today, has four basic components to it: the congregate meal program, the home delivered meal program, nutrition counseling, and nutrition education. Why that's important? Because this isn't just about delivering meals. This is a health and safety program, and we're going to talk more about that today, and it's really, really important. Good nutrition is prescription, no different than a prescription drug. It is so important to the overall health and well-being, independence for older adults across New York State. So we have here in New York about 4.3 million people over the age of 60. As I mentioned, we serve hundreds of thousands of people, already have the largest program in the country, but we saw about a 70% increase in meal delivery, and that even broadened to things like shopping assistance, changing our congregate sites to a different type of model so that we could slow the spread of the COVID virus. And how are we trying to address that? A couple of different ways. We have amazing flexibility under the federal disaster declaration to use our resources to meet local need. And not have state government or anybody else get in the way, but let local decision makers make those decisions on those funds. We received that same flexibility under Governor Cuomo's executive orders that allowed us to meet locally determined needs locally. We've had a variety of influxes in cash through the various stimulus dollars that equaled about 82 million. And we're expecting with the new Biden plan that was passed by the House last week to bring an additional $90+ million to the state. We're also working with our partners at the state level and FEMA to bring additional nutrition resources to the state so that we can continue to meet need and make sure that nobody goes hungry and everybody has the nutrition that they need. Globally, now listen to this, since 1975, we have served collectively as a network in New York State almost 1 billion meals. Almost 1 billion meals since 1975 to almost 11 million people. But that takes a lot of work. It takes a lot of effort. There's a behind the scenes process that needs to be undertaken to make sure that that happens. And that's what we're going to talk about today. So let me introduce this amazing panel that I have, and I thank you for joining us today. And in the order that I have them on the page, I'm first going to introduce Becky Preve. She's the Executive Director of the Association on Aging in New York, which is a membership organization that represents the 59 area agencies on aging that cover the entire state. The mission of the association is to support and enhance the capacity of New York's local area agencies on aging to work in collaboration with the Aging Network to promote independence, preserve dignity, and advocate on behalf of older New Yorkers and their families. So welcome, Becky. We have Cardoza-Izquierdo. and she's the director of the Rockland County Office for the Aging. She's also a board member and the vice president of the Association on Aging. Prior to joining the Office for Aging, she spent 30 years serving the public in the healthcare administration field, most recently at Nyack Hospital. In the last 2 years, she has transformed the Office for the Aging, creating an official newspaper, Moving Forward, which is circulated to more than 45,000 households in Rockland, instituting mobile satellite offices coined as OFA on the Move, which brings the services of the Office for the Aging to residents throughout the county. That's certainly a model that we've all had to adjust to, is moving from a bricks and mortar into a more mobile, type of infrastructure. And she has been, just a spectacular addition to our network. Also has that healthcare background. Gina Cantanucci-Mitchell is the executive director for Washington County Office for Aging and Disability Resource Centers. She has served in this role for the past 9 years. Gina has a history of various types of social work, to include working with youth in several capacities, to include guiding them through the 30-day wilderness expeditions, which maybe we'll do another Facebook Live in the future on that, because I'm interested in that. She's also served as child protective caseworker for 7 years, and was also a disability recipients' rights office for 8 years in the Detroit metropolitan area. Gina currently serves as a board member for the Association on Aging and is the vice president for Homefront Development Corporation, a not-for-profit that assists counties through housing, rehab, affordable senior rental housing, and downtown revitalization programs. So Gina, it's great to have you here as well, and we're glad we stole you from Michigan, and you're part of the upstate community here in New York. We have Liz Humiston. We'll call you Liz. She started with Washington County Office for the Aging as a meal site manager. In this role, she's developed a mobile congregate program to serve aging adults in their Washington County communities. Liz was promoted to nutrition service coordinator in 2020, right before the COVID-19 pandemic started. So talk about on-the-job, quick adjustments and training. Liz is all about that. Her role is to oversee all the nutrition services operations in Washington County. And prior to joining the Washington County team, she was the manager for Golden Corral Restaurants for 10 years. So Liz, welcome to you. And last but certainly not least is Peggy Lindsey. She has served as Washington County Office for the Aging for the past 20 years. She is a full-time aging services aide, which includes oversight of the home delivered meal drivers. Peggy serves on the front line for the nutrition program. And of course, her dedication and commitment to serving all of the Washington County older adults as ambassadors is truly commendable. So look, all of you guys have great expertise in a variety of different areas. Families, right? Because older adults don't live in the Office for the Aging. They don't live in an isolated, they live in families that have, parents, grandparents, younger individuals, grandchildren, etc. You work at the community level, day in, day out. You see people on a day in, day out basis. You have the pulse of what is happening in your communities. You have healthcare experience. You have disability experience. This program is not about a meal. That's the linchpin starting point of really how the entire aging network started back in the late 50s and 60s, actually here in New York State and New York City. So it really is important to categorize this for what it really is and how important it's been during the pandemic with people staying home, how it impacts their health, how it impacts medication absorption, how it impacts chronic disease management, all of those types of things. I think it's really important to state that. But let's start with you, Becky. So what you don't have in your bio is you were a hospital clinical social worker for 10 years. You ran an office for the aging prior to representing the 59 counties. So from the lens that you had and the various responsibilities that you've had over your time, and obviously your current role, tell me in your words about the nutrition program.
So thank you, Greg, and thank you to everyone that joined today. I think I'm going to start, Greg, you mentioned our nutrition program isn't just a home delivered meal. And I think that that's something that many people aren't aware of. You think of a home delivered meal, you just think it's a meal, and it's so much more than that. So as you mentioned, our nutrition program has really 4 main components. Obviously, number 1 is the home delivered meal. So that's either a hot or frozen meal delivered to the door of a recipient. on a variety of different schedules and service structures, but that's one component. We also have the congregate meal program, which prior to COVID, you mentioned the 800 plus senior centers. Those were places where people could come enjoy a hot, delicious meal and also receive social engagement with their peers and activities and programs and services. The two other pieces in the nutrition program that I think are extremely important are the nutrition counseling and the nutrition education component. What a lot of people don't realize is our meals are very regulated. So we have registered dietitians on staff that do a multitude of things. They obviously create the menu and make sure that our meals meet 1/3 of the dietary requirement. This is really important for people that either have high or low BMIs or body mass index. So you can see people that are underweight gain weight. You can see people that are overweight actually lose weight. And we also provide one-on-one counseling services. So if you're a new diabetic who might be struggling on our home delivered meal program, or call your local office for the aging, you get one-on-one assistance with that registered dietitian to be able to talk about what you should and should not be eating on the other meals that you're not receiving through the home delivered meal program. On the health and safety side of things, I think everybody that's on this Zoom today, as well as many people in the community, have an understanding if you've been touched by the home delivered meal program from a health and safety perspective. And so I'll share two things. Number one, as a clinical social worker, a large majority of the admissions that I got referrals on were actually people that were found by a home delivered meal driver. So that's number one on the acute care side. Number two, from the client perspective, every single county throughout New York State has instances where they have found someone in peril based on that home delivered meal safety check. So we're not just dropping a meal off and not getting eyes on a client. Even during COVID, deliveries are being dropped at the door, and then volunteers or paid staff are watching an individual obtain the meal. So there's still that one-on-one eyes and ears in the community. And I'll share with you two stories from Franklin County that show exactly this. We had a home delivered meal client in a rural area with a mild cognitive disorder. She wandered outside her home, had fallen behind a snowbank, and had remained there overnight, had severe hypothermia. The volunteer, instead of just knocking on the door and saying she's not home today, actually searched her property, found her, stayed with her until 911 came. And she ended up spending some time in the ICU, but then was discharged back to the community. None of that would have happened without that volunteer. Another instance where someone didn't answer the door and numerous phone calls were made. I was actually able to personally go to the home and was able to make contact through a window with the gentleman. I broke into his home through his basement, crawled to him, and he had gone to the bathroom and he wasn't able to physically get up. So again, in that circumstance, we avoided a trip to the emergency department based on that one-on-one intervention. And I think that's really the one takeaway from this program is if you or a loved one has safety concerns or has food insecurity, this is the perfect program for you because it's twofold. It meets your nutritional requirements, but it also makes sure that every day someone is checking on you.
Yeah, and I think that's so important. And you're all shaking your head, and we're going to dive down a little bit more. But the reason the five of you are here today is because you have different capacities within this network and different experiences, but each of you is very hands-on. Like there's administrators that, and I don't want to be derogatory because I don't mean it that way, that delegate the work to other people to do and manage. And you guys certainly do that, but every one of you is hands-on. You're at the top of your food chains, but you also were in people's homes doing this kind of work. So again, all of you can answer this, but I'm really looking to Becky and Tina because, what you bring to the table, in addition to the recognition of the value of not only all the aging services, but the nutrition, you bring a healthcare lens to it. And I have said many a times, one of my major frustrations in my 29 years in the Aging Network is the view of these types of services, particularly this one, as a soft service. And that's not what it is at all. And I think the two examples that you described are really so critically important, not only how important nutrition is as medicine and as a prescription, but really that health and safety check. So from your lens as, a clinical social worker in a hospital, Becky, as a discharge planner, this is a really important part of a good discharge planner. And Tina, 30 years in the healthcare industry, there's not much more important to good acute care outcomes and clinical care as to make sure that people have what they need when they get home in order to make sure that discharge plan is followed. And nutrition is a cornerstone of that. So can you just touch upon that briefly?
For me, I would just say that, this is just a piece of the puzzle which provides comprehensive wraparound services. Like you say, you may just think of it as a meal, but the nutrition and education piece leads to so much more, especially with a client's healthcare. And in addition, provides Office with the Aging to give that one-on-one personal experience. And although we're considered a social model, it helps us integrate that social and medical model. So really to provide a comprehensive wraparound type of service for the client, which is really, really important. People are living alone and living longer. So we really have to have that personal interaction to make sure that they can maintain their independence, stay safely in their home, and still get all the services that they need. And it's really a wonderful opportunity, as Becky has focused on, to have that hands-on, eyes-on approach and seeing what's happening. And quite often here in the county, we have 3 different agencies that help us deliver our meals through contracts, and they have that ability to create that relationship as well. It also brings a sense of awareness to what's happening in the client when they're at home. Do they look happy today? Do they look sad? What's going on, Mrs. Smith? In addition, it gives them someone to talk to. Right now during the pandemic, seniors are so isolated. There's a lot of depression happening, but when that driver comes with that meal, it brings a smile to the face of the senior and they have that social interaction. So there's so many different components of what this nutrition program brings for our comprehensive service.
Yeah, I think you're right. And, your point on the eyes and ears and that Becky made is so critically important. I mean, this program is not only providing that health benefit, that nutrition benefit, but it's saving lives because,
Absolutely.
the drivers who are trained, many are volunteers, some are paid staff, know what to look for, know if something isn't right. Our average home delivered meal client is an 83-year-old female who lives alone, has 4 or more chronic conditions, and has a variety of functional limitation, things that, maybe not be able to get out of bed in the morning, can't shop, can't prepare a meal, can't ambulate, can't pay a bill, right? And we're able to provide a variety of services that support and maintain their independence for a very low cost. So Gina, I'm going to shift over to you. We serve a lot of folks in New York, not only in the nutrition program, but in other things. One of the things that I like to talk about before we get into the customers that we serve that have needs is, the older population in general. Not everybody has Alzheimer's disease, is in a nursing home, and needs assistance. There are those that do. That's what we're here for. But the majority of older adults are healthy, are active, they're working, they're volunteering, they're supporting their families, they're supporting the community, the local businesses. But there are those that do need our assistance, and that's what we're there for. So talk a little bit about, from your perspective, Washington County, a little bit north of Albany. So you're kind of right in the heart, just below the Adirondacks on the border of Vermont, Massachusetts. What are the demographics of Washington County? And tell us about your operations in terms of the nutrition program specifically.
Thank you. And thank you for inviting me to be part of this panel today. Speaking about the nutrition program is most certainly a program of my heart. And so I'm very passionate about what it is, and it could not have been described better by each of you in talking about just the terminology of saying it's more than just a meal that's served. So in bring it into perspective of what a county looks like. I'm here today to represent Washington County, and you're right, Greg, that it is. We are a rural county. I mean, we are approximately 60 miles long, 20 miles wide, and we cover an area of 830 square miles. And so we have no cities within our borders. We're largely agriculturally based. So when I speak about the demographics of Washington County, I have to tell you that public transportation is really non-existent, and it only covers a tiny, tiny little piece of 2 small towns here that borders Warren County. So when I talk about the demographics, I also have to speak about food access here in Washington County. We only have 4 grocery stores. We have several small convenience stores, and a lot of them serve as gas stations. In addition, we actually have several food pantries, which a lot of our consumers are accessing food nowadays during the pandemic, particularly. The one plus to being in an agricultural county is the wonderful farmers markets that we have throughout Washington County. So, and also kind of bring it into perspective, we have a population of around 61,000 individuals, and we serve about approximately 12,000 of those individuals are age 65 and older. So given the demographics that I just shared with you and the limited opportunities of access to food, I can tell you that our nutrition program offers individuals another way to provide a healthy, nutritious, and I always tell people that our meals are absolutely delicious. So I'm not going to be subjective on that, but I am. So, yeah, so when I talk about the county operations here, you know, we operate our program with paid staff. We have 3 full-time staff, 14 part-time staff. We also contract out services with the sheriff's department, and thus you can see the sheriff's car that's behind Liz there in that picture. But we also contract for dietitian services as well. And so in this aspect, I'd like to talk to you about our home delivered meals program. When I talked about the demographics, I really wanted to paint a picture of the area that we serve. Again, talking about a location where we don't have highways, we have all county small roads. Some of the roads are still dirt. And so we try our best to reach every individual that we can here in Washington County on those small rural roads. And so when we operate our home delivered meals program, right now we're running about 9 to 10 routes with drivers. So to add on to that, I did speak briefly about how we contract with our dietary services with our registered dietitian, who's Kristen Stewart. She does all of our meal planning, also our menu planning. She also touches on nutrition ed and provides individuals one-on-one counseling, which is something that you had spoke about a little bit earlier. I want to paint a picture in terms of what our department looks like. So I always tell people that when you've seen one office for aging, you've truly seen one office for aging. But I can tell you that every single office for aging has the same core values and the same mission. And we all most certainly follow the same mandates when it comes to operating a professionally run nutrition program. So here in Washington County, we have a central kitchen. We contract with our sheriff's department. And the neat part about our partnership with the sheriff's department is that when they built the building for the sheriff's department several years ago, they actually built the kitchen with the focus of our senior nutrition program. And so I think that, you know, it's a modern kitchen, and it's really nice that the county took emphasis and prioritized the needs of our senior nutrition program when building that kitchen, and just the logistics all around that. So, yeah, so talking about, you know, we can go into details later about, you know, how we've changed during the pandemic. At this time, you know, for home delivered meals, every individual receives a comprehensive assessment, and Tina did speak about that. During the pandemic, we've had to adapt. What we found is that several individuals are a little reluctant, a little cautious, I should say, to have our caseworkers go into the home and perform assessments. And so we've provided our caseworkers with iPads. And so we're doing things like conducting assessments either virtually through a virtual platform, through FaceTime, and also even over the phone. The one thing we've also adapted to is the waiver that was put in place for eligibility guidelines for home delivered meals recipients. And so at this time, our county is serving anyone age 60 and older with a home delivered meal. And so when I touch on that, I can tell you that our congregate meal sites right now are currently closed. And so those individuals, we offered them the opportunity to participate in receiving a home delivered meal. The other piece to our nutrition program is our restaurant dining program. It's very unique to us here in Washington County. What we do is we contract with several small local restaurants And we also have a contract with Market 32 and Price Chopper. And so with these contracts, these restaurants and Market 32 provide a well-balanced, nutritious meal to folks who are 60 and older. During the pandemic, we've seen participation in this program increase. We've lifted the criteria. So we've said to folks, you're more than welcome to use your dining ticket for takeout. And so that truly is like a win-win for all of our folks in terms of they can get a nutritionally balanced meal from, they're supporting a small business. A lot of our restaurants are small mom and pops, family run restaurants. And so being able to support them during this pandemic has been something that we take pride in. So at this time, I hope that I've given an overview of how we operate here in Washington County.
You have, and I appreciate that. And there's a lot to unpack there. So I'm hoping the Golden Corral is part of that program, given Liz's background. If not, then, there's some work that needs to be done there. But I'm glad you raised that, because we do have 9 counties that actually operate a restaurant program. That's not unique to the AAAs, but I think a lot more can be done that not only, helps provide that meal, but supports local businesses. And that's one of the things we're looking at with the FEMA grant. But I want to touch upon a couple of things, and I'm really chomping at the bit to get to Peggy and Liz.
Yeah.
But there's a couple of things that you mentioned, and then I want to ask Tina a question before we kind of get into the mechanics and get done with the contextual stuff. You talked about the geography of Washington County being rural, lack of grocery stores, mostly farming community, lack of transportation. And for folks that are watching, that's not an outlier. That's the majority of New York State. 95% of communities don't have public transportation. Many are rural. Those types of issues, that's really what I'm trying to get at, is how do we as a state deliver 30 million meals a year when that's the context that we're dealing with, and why, I'm so interested in hearing from Peggy and Liz. But then the second question, in addition to the agricultural things, in addition to what we've done, there's been a lot of coordinated activity under the governor's Nourish New York initiative, for example, to provide farmers an opportunity to provide their commodities directly to food banks. Commissioner Ball is a great partner with us at Ag and Markets to expand farmers markets and those types of things. But we have people who are at home, maybe staying at home because they took seriously the warnings of not to go out. And then there's those people at home that are just going to be at home because they can't get out. They can't shop. They can't prepare their own meals. So Tina, from your county's perspective, Rockland, what are the types of things, right? There was a pre-COVID period where we kind of all did more or less similar types of things in the same way. And now we're in this new environment, this new normal that I think is going to, hopefully when COVID goes away, I don't think the lay of the land is going to change, nor do I think that it should. I think we should be provided the types of flexibilities to really be innovative. But from your perspective, due to the pandemic, how have you been able to change some of your business models? No different than Gina, almost all of the 800 senior centers closed. I mean, and most of them have remained closed. A few have opened with, minimal participation, but en masse, those types of things haven't changed. What have you had to do to, basically react to the situation and still meet a growing need with a different type of infrastructure?
So here in Rockland, it became quite clear early in the pandemic that anyone who was listening to Matilda's guidance was not going out, was not going into the supermarkets. And we had people very anxious and frustrated and quite frankly scared. How were they going to get a meal? How were they going to get food? They didn't have any more bread. They didn't have any more milk. And we were able to quickly mobilize, and we created the Shopping for Seniors program. And what we did was we created a shopping bag full of shelf-stable food in addition to bread, milk, and eggs. And we used our Rockland Senior Volunteer Program, along with many of our partners who volunteered their time to actually deliver these bags of groceries to the seniors at home. All the senior had to do was call in and say that they were 60 and over and they were in need of food, and we were not going to let anyone go without food. In addition, anyone who chose to sign up for home delivered meals, we made that available to them as well. So what we've seen is as things have kind of somewhat normalized, the new normal, there are still some seniors who are really scared and anxious about going out, and we're still taking care of them as if they need the grocery shopping, we do that for them. We've tried to get them on home delivered meals. A lot of what we've done also is provide through our food drives. We have a drive-through right in front of our office. We set up, a tent, and we have tons and tons of food. We created a boxed shelf-stable system to provide meals to them. The senior drives up, they roll down their passenger side window, and we put a box of food into their car. Anyone who can't come to the drive-through, our homebound seniors, we have our Rockland senior volunteers bring the food to them. So we're really trying to find different ways to make sure everyone is getting the daily nutrition that they need. In addition, we've really expanded our home delivered program. Anyone who was on congregate, just like Gina said, who's going to senior centers, they are closed. So all of those clients who wish to receive home delivered meals, we've put them on home delivered meals. We've also offered from a daily delivery to a frozen 5-pack delivery if they chose for that as well. So there's all different kinds of options for the seniors now. And I think that's really important because I think you can't create one specific model of a program for everyone. Everyone has a unique situation, unique needs and desires. So we really are trying to make sure that we meet those needs and desires during this difficult time.
Yeah, I think that's right. So, this question, and then I really want to talk to Liz and Peggy, and I appreciate your patience with getting down to the mechanics. And Liz, it doesn't look like the police behind you have taken you away yet, so hopefully we'll have time for that. I'm just going to ask you a straightforward question. Becky, Gina, Tina, whoever wants to answer this. If you didn't have the ability, the authority, and the additional resources to change the model and do what you've had to do over the past year, what would have happened to these people?
So I'll answer from a state perspective, and I'm sure Gina and Tina will chime in. So, as Greg spoke to, I represent the 59 area agencies on aging across New York State. And I can tell you unequivocally, without the flexibility, without the additional revenue that was brought in, and without the ingenuity and the community partnerships that every single Office for the Aging created and established and pushed through, we would not have been able to keep people safe. We would not have been able to keep people fed. And I think it's so important that as we have worked through this pandemic, we take the lessons learned as far as local flexibility to target resources where they're needed, as well as to serve the most number of people the most efficiently, is something our network is adept at, and they have done an unbelievably good job throughout this pandemic, and I could not be more proud of the partnerships that we've seen.
Having a senior being food insecure and not knowing where they're going to get their next meal from creates an array of different cause and effects, right? So the level of anxiety, frustration, high blood pressure, not having food really creates a multitude of different issues. So without all of the support that we've received, Greg, I want to thank you for all of the advocacy that you've done for us. Becky, amazingly, we've been able to really meet the need. I know here in Rockland County, our home delivered meal program has increased trifold. And these are clients who really need the food, who had the ability before to get them from everywhere else, but with the pandemic, they just didn't. So it would have been horrific. It would have been tragic to not be able to serve all the clients that we are serving during this difficult time.
Yeah, and I have to double everything that you said because it's so true. The advocacy that you've provided us and the support and the waivers and the flexibility helped us do what we do. And most certainly, it was interesting during the pandemic when we were showing up at people's doors. First off, people who have been, a lot of our folks have been isolated. So having that friendly face, a smile, someone physically in front of them saying, "How are you doing today? Here's your meal," is priceless. So being able to continue that program during the pandemic, it benefited us and our state of mind, as well as these folks who couldn't believe that we were still operating, under the declaration. So we absolutely appreciate the flexibility. It allowed us just to build on partnerships that we've had one piece in Washington County is we have a great kind of informal network amongst small organizations and towns. And so what we saw is those partnerships just build even stronger, and particularly the towns. I think the towns, they were all working individually, and they needed us to be that central hub, the place to go to. And so we were supporting them in a lot of their efforts. They were doing an unbelievably amount of great work within their small communities and serving folks who were in their homes. So so that was great. It was great to be part of the hub where they could come to us and we can give them, support. We can give them answers. We can give them someone to go to and help them through this definitely uncharted time.
Yeah, and you guys are such a trusted resource. I mean, you're a different kind, and we are a different kind of network that is really open and welcoming, that people feel like they can trust. And in addition to the meals that you guys provided, you provided masks, you provided PPE, you provided hand sanitizer. I remember not being able to get toilet paper. You provided personal products and things like that. And to go back, like, what would have happened if you didn't have it? Well, here's the list of the top chronic conditions for our participants. It's arthritis, it's diabetes, it's heart disease, it's high blood pressure, it's high cholesterol, right? I mean, all of those things get impacted when, your nutritional status changes. So now I get to really dive into the nuts and bolts because, I got a couple numbers here. I got Rockland's numbers, and this is, to Peggy and Liz, because you're going to tell us how you did this, right? So Rockland pre-COVID served about 47,000 meals. And then a year later was at 170,000 meals. We'll take Suffolk County that did about 600,000 and went to 830,000, and Erie about 600,000 to 900,000. So now here we are, this is all going on, right? We're kind of doing our thing. And then Liz and Peggy, it comes down to you. The phone's ringing off the hook, right? Tell us what the day is like. What time do you start? How do you manage this? How do you build a home delivered meal route when you got to go 60 miles away to try to serve somebody? I mean, walk people through. It's one thing to be on the receiving end and get a meal, but there's a whole behind the scenes, apparatus that needs to plan, be vigilant, connect the dots, have, A, B, and C, and D plans. How do you do this every day?
Well, thanks for having me, Greg. I appreciate it. Around here, it really comes down to coordination. We have a solid team. I have a solid team behind me. We start our day around 7 in the morning. And probably the first thing that happens is that myself and the two team leaders, Mary and Peggy, have a meeting. And we talk about everything from meal planning to the routes. We have frequent cancellations and restarts. We make sure that everybody is pretty much taken care of on the routes. So that's our main concern. Then we move on to the driver schedules, receiving the meals from our central kitchen, making sure that everyone on our routes have a meal. I am in contact constantly with our dietitian, Kristen, and the kitchen manager, Tony, at the central kitchen at the Washington County Correctional Facility, along with Mary and Peggy. It truly does take a team to do this. After the meals are distributed, of course, I have administrative duties. Mainly, I keep my eyes on the phones because I need the drivers to know that they have the support of our staff behind them. Sometimes when you go out on the meal routes, and we are a very rural area, there's some challenges to it. So I want to make sure that the drivers know that I have their back, so to speak. We do a lot of shuffling with the routes. We try to make the routes fit into certain times, so they fit into, the temperatures are always a concern. We do a lot of route planning. We do a lot of communication between all of us, really.
Yeah, so I mean, even just going through some of that, right? It should it should tweak people to understand that there's a lot of moving pieces here to this, right? So you talked about your RD. So why would you need that? Because Becky talked earlier, we meet the highest federal standards in the quality of meals. That's the way that we operate. Gina talked about the taste of meals. I was kind of laughing to myself because in 29 years that I've eaten in senior centers and home delivered meal programs, I've never had a bad meal. I actually think they're very, very good. I want to dive down to you, Peggy, right? And ask you a couple of questions, because not only do you deliver the meals, but you oversee the drivers. And so a couple of questions and that I'm interested in your take on. First of all, we rely heavily on volunteers. These are not always paid drivers. So, we go through a time where people over the age of 75 are told to stay home, stop the spread. You're most at risk. Your volunteers probably fit in that regard. So, building off of what Liz said, what do you do when you got 3 people that call in that can't deliver that day? Did you see a reduction in capacity? How do you manage the delivery? How do you bring people on, bring people off? I mean, there's so many detailed mechanics that the two of you, have to manage every single day to make sure that people get what they're supposed to, that people who, for one reason or another aren't getting it, that's all in the mix. But then how you just manage your infrastructure.
Well, we have a good team for one. We communicate a lot and we make sure that if somebody can't do one route, we will jump in and do it. We just make sure that we work together and we bounce off one another, and some days it's overwhelming, but it gets done.
How did you have a reduction in capacity of your volunteers?
No.
That's great. That's really great. What would you do? I don't know how many drivers you have. If one person, for whatever reason, can't come in that day, winds up in the ER themselves, is sick. How do you manage that?
Well, we have some per diem drivers that come in if everybody is saying being used on a route because people are sick. Sometimes us drivers will double up and take on another route. We always seem to find a way to get it done.
Yeah, and having been part of, not only starting my career as a case manager and going on some of these routes, but of course, as we highlight this month, over the last couple of years, I've had a great opportunity, and just how thankful the recipients of the meals are, and to see that smiling face, and for somebody to be able to look at and see if there's food in the refrigerator, to see if there's oil in the tank or wood, to make a visual inspection of somebody and make a referral if something just doesn't seem right. Like that interaction and connection of people like you, Peggy, and the people that you oversee really can't be understated. I mean, Becky talked about the older woman with a cognitive impairment that was found out in the backyard in the middle of the snow. I mean, I've heard cases like that over and over again. In your experience, can you give me an example or two based on what you do every day or your drivers do of really that kind of, that without that intervention, you're talking about people dying, you're talking about people in prolonged healthcare experiences that without, again, this isn't just a meal, without this whole universe of what this program intends to do, what the impact is.
Well, perfect example is back in August, I was going to deliver a meal to one of my clients. When I had got inside her apartment, she was on the floor and she had been there for 24 hours. And what had happened was that she was getting some milk to go with her meal, and she spilled the milk and tried to clean it up and fell out of her wheelchair. So I'm trying to keep her alert, trying to talk to her, but she was incoherent. So I called 911, went back to her, started talking to her, waited for 911 to come. They got her. And she was in the hospital for 3 weeks on life support. And then they sent her to rehab. But now she's back home, living in her own apartment, as happy as can be. And that is something that when people say it's only a meal, it's not only a meal.
And I think that's exactly the kind of example. And so, I'm going to ask you, Tina, about your daily operations and what you see. And, Becky, go back to when you were a director, because yours was a little bit differently organized. And back to Gina's point, you've seen one AAA, you've seen one AAA, right? So Tina, what's, at least from the nutrition program perspective, what's a week or a day look like for you and your team?
So I think pre-pandemic, it was very different. Everything ran according to schedule, according to plan. And then this pandemic happened. And as Gina and Liz and Peggy were saying, certain parts of the program were impacted. And one of the things that we see here with our programs is the volunteerism piece, right? So as you said, Greg, a lot of the volunteers, especially for us with our senior volunteer program, were of age and had to stay home. But I have to say that I have truly seen a humanitarian effort here in the county from other people, other entities, other community-based organizations. We pick up the phone and we say, hey, we're really in need. Can you help us? And absolutely. I mean, I've had the Police Hispanic Society here. I've had real estate agents here picking up the phones, helping deliver meals, helping deliver boxes of food. And as Liz and Peggy are saying, we just get it done, whatever it takes. Our main priority is to make sure that our senior needs are addressed day in and day out. So, it's difficult, but it's not, because that humanitarian effort really makes it quite rewarding. And it's wonderful to see people come together. Not to say that there aren't hiccups during the day, not to say that some of the routes aren't covered, not to say that, some of the administrative people have to get out there and do the routes, but it always gets done, like Peggy said.
Yeah, and I'm glad you raised that, because, Becky, we have seen, and, the governor talks about all the time, when bad things happen, we've never had a pandemic before, but we've had ice storms and flooding. And so, the best of New Yorkers come out. And I think, one of the things that you've been doing is collecting the types of stories of how the network really has, to Tina's point, the community really rallied around our population in a variety of ways. So, I remember Tina expressing to me I believe it was ShopRite, the supermarket, and the partnership that they have with the county executive, the Office for the Aging, and ShopRite. We saw in a couple of communities, the Boy Scouts and the Girl Scouts really lending a hand. But from your perspective in collecting these statewide type stories, what are the other types of ways that the community, our non-traditional partners, really recognize there's a need here, and we're going to do something on behalf of the people that matter to us?
So I think you raise a wonderful point, and this is something that continues to evolve, right? We're almost a year into this. So really when March hit and we had Matilda's guidance and the closures, we had to change the service delivery overnight, which the 59 offices for the aging did so almost without any type of hiccup. And so that initial kind of rollout and change in service delivery just showed such creativity. So SUNY schools were closed down, teachers that were already vetted, so they had background checks completed, they volunteered to deliver meals. Suffolk County, as you referenced, utilized the Boy Scouts. General school systems that were shut down, those individuals volunteered. Department of Public Services, so highway departments within county governments were delivering meals, which the stories coming back from people that weren't traditionally looking to volunteer, who said, I'm going to continue this because it was so worthwhile, have really just increased. We've seen, partnerships with food banks, rescue missions, faith-based organizations, the Salvation Army, the United Way. We've seen counties, as you spoke to, that delivered toilet paper with their home delivered meal program, who did care packages. Grab and go sites have been stood up across New York State where people can drive through and get food. As far as the home delivered meal program, I think something that was very telling to me, we all have these stories of finding someone in a medical emergency. Broome County in January of 2020 had 20 individuals that they responded to just in the month of January that had a medical condition that the home delivered meal driver addressed. So I think, this network is nimble. We're in the communities. We partner with anybody and everybody, and really tried to transition our service model to make sure we were serving all older residents. And I think something that really resonates with me, I get the pleasure of looking at all these stories and giving thanks. But again, they're consistent across our entire state. These aren't isolated. Every community is doing these partnerships. And I'll just share with you, this past weekend, I was shoveling the end of my driveway, and a volunteer here in Franklin that I had recruited, who was very hesitant to ever deliver meals, stopped in, and she was sharing with me the value that she gets from being a volunteer, which we often don't talk about, and how it's really changed her life. And that in certain circumstances, there's a whole routine built into this delivery, right? It's not just I'm dropping off a meal. She gets the mail, she brings the meal in, she opens up the Oliver tray, she then brings the garbage out. So, you know, on top of just delivering that meal, you have an individual that can't get to her garbage can, who knows her meal driver is going to bring her garbage out on garbage day. So I just think that it's an opportunity to highlight this amazing network, and more importantly, our nutrition program. That's not just nutrition. This is a holistic, wonderful program that serves people throughout their lives and can really be a game changer as far as people needing to go to a higher level of care.
Yeah, and I think that's so important. And I think, you know, we were all really concerned in the beginning that we were going to lose significant capacity for a couple of reasons. That many of the volunteers in the food prep business that are actually making these 30 million meals, you know, are older and volunteers, and that many of our drivers fit the same regard. But the two examples is, we had a lot of people, as you mentioned, non-essential state employees, non-essential county employees, the National Guard, general volunteers, teachers, students, college kids, people that all stepped up. And I think that that's been amazing, and so thankful for all of us that we had that. And in Washington County, you didn't lose any volunteers. I think that's amazing. Just show the commitment to the value of what it is that gets done. In the longer term, I have concerns about that. And, you know, one of the things that I'm trying to push at the federal level is a rewriting of the Older Americans Act that will have a significant investment in workforce for programs where we rely on volunteers, so that in type emergencies like this, or in our ability to expand services, we don't have a capacity concern. But let me go to you, Liz, first, and then anybody else can kind of jump in. So we've talked quite a bit about, you know, home delivered meals, and that was really the model that we had to shift to for a variety of reasons. We talked about congregate meals and how that business model changed to home delivered meal, grab and go. Talked a little bit about the shopping assistance that, you know, became part where people can certainly prepare their own meals, but they didn't want to go out and potentially contract or spread the virus. What we haven't talked much about is two really, really important components, nutrition counseling and nutrition ed. So can you just briefly say what those two things are and why they're equally as important into what we call the nutrition program?
Well, we've found that we've had many challenges reaching our seniors here in our county. We are, again, a really rural county. So we feel like we've made great strides. Together with the dietitian, we've been doing some YouTube cooking demonstrations and some Facebook posts, just trying to reach out to the community a little bit. Kristen, our dietitian, spends a lot of time on the phone. She does counseling, and she does weekly check-in calls with a lot of her folks, with a lot of our folks.
And Liz, what's the purpose? What's the purpose of that? Tell me why that's important, what your dietitian is doing on the counseling and education front, because on the receiving end, there must be an issue or a reason why somebody would need that connection to your RD.
Sure. Well, the purpose, I guess during the pandemic, became more of a social aspect. We were checking in with the folks, just trying to make sure, you know, she's another line of defense for the folks to let us know how they're doing. She works very hard at trying to make a connection with them and trying to tailor dietary needs to suit them. Not everybody's the same when it comes to, you know, their diet. So we try to work very hard at our meals and with our dietitian to make sure that their needs are met.
Yeah, and I think that's I mean, you hit the nail on the head, right? We have these individuals that have diabetes, hypertension, other chronic diseases. They might need a medical diet or higher in protein, lower in salt. And that's what your RD really does, is provides general education on good, healthy eating habits. But then the nutrition counseling dives a little bit deeper, to your point, which is helping people that might have a specific nutritional need in order to maintain their health and independence meet that need. So I appreciate that answer. That's it. And I think that that's a really, really important part and component of this. And it has been challenging. You know, we're trying to move to virtual a lot of things. But whether you're in Rockland, you're up in Franklin, or you're in Washington, or you're here in Albany, there's areas where you will not have access to technology. You do not have access to broadband. Your speeds are not fast enough to do those. So I think, you know, what we're always trying to do collectively is balance the opportunity to expand technology with the reality that it's not going to work for everybody. And I think what your RD is doing, whether by phone or in person or on a technology platform, is right on the money. So I'm going to wrap up this way. I'm going to give you guys an open opportunity to express anything that I haven't asked you to this date. I think we've really done a good job in making the point of how important this collective program is to the independence of the older adult, that it supports caregivers by being able to provide meals and other supports in the home, that, you know, you talked about the assessment that allows us the opportunity to help people get other benefits and assistance, whether it be SNAP or HEAP, or you know, participate in the low-income subsidy or other types of things. It's the eyes and ears, not only for the community and the family, but for the healthcare network. I firmly believe we saved the healthcare system in a big way during this pandemic, and will continue to do that by providing basic services that people need to survive. And the nutrition program is one of them. But if there's anything that we didn't cover that you want people to know, whether it be during the pandemic or, you know, whatever the new normal is going to be after, I'd love to hear from you, and please don't be shy before I wrap up. So Gina, any additional thoughts that you may have?
You know, key words come to mind. Definitely when everyone here was talking, you know, the word holistic just screams out. You know, is just such the perfect word to talk about what we've done, what we do on a daily basis. Just it's a wraparound approach. And so, you know, like when Peggy had to go out last month and buy Valentine's Day gifts for a spouse because he couldn't get out to get them himself, and it was very important to him. And she just, you know, just that extra level of thinking outside the box, just that extra piece of kindness, the simple acts that we do, just really is kind of the basis of what we do on a daily basis.
I love that you brought that up, because, you know, I think what this network has lived for almost 50 years is person-centeredness. Yep. We're entering this new phase of the 4 M's, right? Age-friendly health systems, and the number one is what matters to you. What you're talking about is the personal relationships that get developed. And when you see somebody like that example that you provided, you know, people aren't going to run back to you or to others and say, can I do? They just do it because it's, you know, we're human beings and that matters to somebody. So I think we can't underscore that enough. There's just so much more to this. Like Becky's, you know, somebody shoveling off the front porch so that they don't slip and break their hip, or bringing in the mail, or the garbage. I think that those are these things we just don't think about that happen every single day on these 2,100 home delivered meal routes throughout New York State. Liz, any ending remarks or additional thoughts from you?
I just feel very lucky that I can be a part of this organization. I'm new to delivering meals, and I have made some friendships that are truly, I'm just lucky to have these people in my lives. And I'm just grateful.
That's great. I mean, it is awfully fulfilling, right? I mean, we're in the helping business, and that's exactly what you do. Tina?
I just want to echo your sentiment about fulfillment. This has been one of the most rewarding times in my entire professional career. It's so important to me to really be able to make that difference and know that I'm helping someone who really, really needs it, especially during this difficult time. I really want to say, I think, and I speak for all the AAA directors, that we should really give a shout out to our Office for the Aging staff. I have to say that my staff, we are a very small staff, we're a staff of 14 people, and we serve 68,000 seniors. I have to throw them out of the office. Go home, it's time to go home. There has been such an outpouring of devotion and dedication to serving the seniors, especially on the nutrition side, where that's really key for their health and well-being. So I think that in addition to thanking you and Becky for all that you've done, I think that, I'd really like to say thank you to my staff and thank you to all the AAA staffs that really have dedicated their time to making sure that we have been successful in meeting the needs of the seniors. And I think, everyone has a family, everyone has their own personal things going on, but to really see the dedication that I have seen in the last year, it is super impressive, and they deserve so much applause.
No, they really do. And I'm glad that you raised that. I mean, this network has met every challenge always that it's ever been brought to. And I think the nimbleness and quickness of being able to respond to this and continue to do that is a testament of just the amazing staff. Peggy?
Just got to say that I've enjoyed the 20 years I've done it. I've met a lot of nice people.
Awesome. Well, and they've met you, and I'm sure they would say the same thing in the role that you've provided. So thank you. Becky? You're on mute.
Story of my life. I was having internet issues. I'm sorry about that. The one thing that I would like to say as far as the takeaway on the nutrition program that wasn't mentioned is this is not based on your income. This is based on if you have a need. So it's not an entitlement program that you have to qualify for financially. So it does serve all older New Yorkers. And on top of that, I would just like to say a very heartfelt thank you to Greg, with you and your leadership at NYSOFA being a partnership through this time, as well as to every single one of the 59 directors throughout the state and all of the staff. They do an incredible job making sure that they're serving.
Yes, and thanks for that. I do want to say, just if there are individuals that are listening to this, under traditional rules for home delivered meals, there is an assessment, and you have to meet a need criteria, not a income criteria. That is not the case now. We are serving people who are over the age of 60. Our congregate program, anybody who's over the age of 60 can access a congregate meal at any time, but there are some differences between the two, but not while we're going through this pandemic. Our job number one has been to serve people, and Gina and Liz and Becky and Peggy and Tina and the other 57 counties around the state are all doing that on your behalf. I want to thank, again, Gina, Liz, Tina, Peggy, and Becky for spending some time with me today, sharing your experience, showing that this is way more than the soft, fluffy service that sometimes it gets painted at. There's a lot to this. There's a lot of mechanics to it. The value of it is unquestionable, without a doubt. I do want to thank Kelly Matija. She's our communications director who makes all of this happen behind the scenes. But I'm going to ask you for two things now for folks who are listening and to share this. Two things that would be very important for you to consider is, number one, consider making a donation to your local county office for aging. Every dollar that we can raise goes back to helping to feed somebody that we talked about today. The average person's an 83-year-old low-income female that lives alone. The other thing is we're always looking for volunteers in food prep, meal delivery, transportation, health insurance counseling, but particularly around the meal program, could always use volunteers. And I think Becky talked about the research behind the value to the volunteer in addition to the recipient of that service. So if you're interested in either of those two things, please contact your county Office for Aging director and office. That's a very easy thing to do by just punching in your county and Office for the Aging, and you'll find that link. So thank you all for joining us today, and I'm sure we'll be back in a week or two But we're kicking off our March for Meals. I'll be out in Suffolk County, Rockland County, and Orange County to do a home delivered meal route, to do a grab and go, to say thanks to the staff, to say thanks to the community for supporting our older adults, not only through the month of March, but for every day during the year. Our network makes me look great, but it's the folks here that are on this Zoom and all of the thousands of others across the state that are doing all the hard work and deserve all the credit for keeping our loved ones healthy, safe, independent, and with eyes and ears. So thanks for joining us today. We'll see you soon.
Thank you.
Thank you,
Thank you.
everyone.
Thank you.